Good morning to one and all. I am Ramani, Professor, Department of Fundamentals of Nursing. Course name, Nursing Foundation. Course code 603. Topic, nasogastric tube feeding. Definition, nasogastric tube feeding refers to feeding the patient through a nasogastric tube that is inserted through the nose into the patient's stomach to meet the nutritional needs. That is called as in a definition of nasogastric tube feeding. Once again, repeat definition. Nasogastric tube feeding refers to feeding the patient through a nasogastric tube that is called as a nasogastric tube feeding. The tube is inserted from the patient nose into the stomach for the nutritional purpose. That is called as a definition. Next, we will see about purposes. To feed the patients. Another one, to administer the patient. Those who are unconscious patient, that patient to administer the feeding to the patient. Another one, to administer the medication. Those who are having some of the oral injury or the unconscious patients, that patient to administer the medicine through the tube, that is NG tube, that is called, that is the main purpose. Another one, to assess the tolerance of feed post-operatively. To assess the tolerance of feed means any other injury over the or any other fracture of the jaw or any inflammation of the mouth. So these are all the things indications of that in NG tube feeding. So that is in a third point. And fourth point, to provide adequate nutrition to the patients. And fifth one, to give large amount of fluid for therapeutic purpose. That is in a fifth point. And sixth, to provide alternative manner to some specific clients who has a potential or acquired swallowing difficulties. These are all the purpose of the NG tube feeding. Once again, I repeat: feed the patient, administer the medicine, assess the tolerance of feeding in post-operative period, and to administer the adequate nutrition and large amount of fluids for therapeutic purpose, and to provide alternative manners to some specific clients who has potential or acquired swallowing difficulties. That is called as purposes of NG tube feeding. Next, we will see about indications. What are the nasogastric tube indications? One, for inability to ingest, chew or swallow the food. Those who are having any oral cancer or any other oral inflammations, that patients you can applicable. This is applicable for NG tube. Another one is undergone surgery of the mouth, throat or esophagus. Another one is paralysis of face or throat. Then another one, indications, fracture of jaw. Those are unconscious patient, too weak to swallow the feed. One, for inability to ingest, chew or swallow the food. That patient you can administer for NG tube because the patient having any other oral infection, inflammation, cancer, any so that patient you can administer for the NG tube feeding. Another one, any other surgery like as in a mouth or throat, any other tracheostomy or mouth for any other oral surgery or any other cancer, cleft lip, cleft palate, like that. That patients you can administer for NG tube feeding. Paralysis of face or throat. The patients having any neurological problems, that times it leads to what will any other hypertension, diabetes patient, it leads to the paralysis, and that patients difficult to chew, speak, intake of foods and medicine. That patients, the paralysis of facial muscles, so the patient has difficulty to take the foods and medicine. So that patient you can administer for NG tube to the patients. Another one, fracture of jaw. Fracture of jaw, that patients, what will happen? So if difficult to swallowing, difficult to take the medicine and foods, so that patient are suffering. So that patient you can select it to and then apply for the NG tube feeding. Another one is unconscious. That patient is a very difficult, they are not conscious, so the patient difficult to take the medicine as well as the food. That patient you can administer for NG tube feeding. Next, the too weak to swallow the food. For example, cleft lip, cleft palate. So that types of patient you can administer for the NG tube feeding during the any other illness or admitted in the hospital. So far we discussed the indications of nasogastric tube feeding. Once again repeat: inability to ingest, chew or swallow the food, undergone the surgery of mouth, throat, esophagus, and paralysis of face or throat, fracture of jaw, unconscious, too weak to swallow the food. This is very important when you are administering or applying the NG tube to the patient. Next, we go for the preliminary assessment. The review medical history is must for everyone, staff, nurses, as well as the doctors. Assess the patient's height, weight, hydration, status, and electrolyte balance. Then only you can administer for the or the applying for the nasogastric tube feeding to the patient. Then assess the patient's mental status. Those who are mentally retarded patients, that patients are contraindicated. So difficult to administer or apply this NG tube to the patients. So that things that things also you can assess. Assess the gag reflexes. Assess the gag reflexes, then auscultate the abdomen for vowel sound also. It is in the abdomen or not with the use of stit. Okay, the some of the three methods you can find out the tube presence in the esophagus or the stomach or not, like or the respiratory tract. And so these are all the preliminary assessment of the patient. One for review the medical history. This NG tube prescribed this patients or not, the nurse when you are administering or are applying for the NG tube. Before that, the nurse should concentrate or keep it in the mind to check the medical history of the patient and doctor's order also. Another one, assess the patient height, weight, hydration status, and electrolyte balance. And another one is assess the patient's mental status when if they are mentally ill. That patients, if you are administering, it is dislocated. After that, it is dislocated, or sometimes it's withdraw the NG tube. The patients don't like to irritating or aggravating the behaviors take place. Aggravation of the behaviors take place. So you can assess the mental status also. Assess the gag reflexes and auscultate the abdomen for vowel sounds. Next, we move for the equipment. What all the things is need when you are inserting the nasogastric tube? Yeah, clean tray, lined with the paper containing nasogastric tube of appropriate size 8 to 18 inches and stethoscope. And for tube, it is 8 to 18 Frenches. This is in a, you can assist when it is you can assist that level and sizes also. That is must in this 95 centimeters in millimeters, and the stethoscope is must. Equipments is another one. Equipments, one for nasogastric tube, and first thing is you can assist for 8 to 18 Frenches and stethoscope. So this in the scale 825 mm must you can assist. Then another one is small basin filled with ice or warm water. Why you can, this is must because of to remove the stiffness of the tube, and water soluble lubricant to lubricate, that is lubricate the tube, because easy to insertion, this is not eroded or injured the inner side of the tissues, and normal saline solutions for irrigations only. Tongue blade is must to depress the tongue. So easy to insertion of the tube into the stomach. And asepto bulb syringe or Tommy syringe 20 to 50 ml to auscultate the bowels, auscultate when you are in after the incision, you can inflate the air into the stomach as well as the aspirate the stomach content. And flashlight when the tube is inserting properly or not. Non-allergenic tape, one bite and tissues and a glass of water with a straw and topical anesthetic and lidocaine spray or gel. These are all the equipments of the patients. One thing, and for the clean tray cleaner with a paper containing nasogastric tube, the size is 8 to 18 inches, and stethoscope. Small basin with a ice water or warm water, water-soluble lubricant jelly, and normal saline solution, tongue blade, asepto bulb syringe, and flashlight, non-allergenic tape, and tissues, and glass of water with a straw, and topical anesthetic, lidocaine spray or gel. This is must for the equipments. And not only for that, and other equipments for clamp to when you are administering for the, when you start to administer the feeding for 1 tumbler. Next the 1 tumbler is over, then you can go for the take another 1 tumbler. Immediately you clamp the NG tube. So because of the stomach content is not let out as well as the air is not entered the tube. So prevent the air as well as the stomach content. Then another one is suctioning apparatus to one thing. Another one is a bath towel or disable pad and emesis basin and a safety pin and rubber band, a non-sterile disposable gloves and tincture of benzoin or skin adhesive pH papers also. These are all things must for the equipments of nasogastric tube feeding. Nursing procedure, inserting nasogastric tube, one for nursing action and rational. Check the physician order for insertion of nasogastric tube and consider the risk associated with nasogastric tube insertion. One for physician order you can check. Then you can administer the nasogastric tube. What is the rationale? This clarifies the procedures and type of equipment is required. Because sometimes if it is a pediatric, you can this is very more clear. This is give more clarification to the nurse, because if you are not check the physician order, what will happen? If it is a small children, you can select for the big nasogastric tube. What will happen? Adult nasogastric tube. What will happen? Difficult to manage as well, difficult to insert. If it is, you can categorize, you can assist, you can clarify your doubt. You can check first. It is the children or adult or adolescent. Depends upon this the size you can select. So that's why one thing. Another one is this patient is indicated patients for NG tube feeding or not. That is you can confirm by the physician order only. That is a first nursing action and rational. And second one, to identify the patients. What is the identify the patient? One, that is identification of the patient, ensure that the right patient receives correct tube feeding as ordered. Identify the patients, because then only this is a Munusami. This patient is a jaw fracture patient. So administer NG tube feeding. This patient is jaw fracture patient. Munusami is a correct person, indicated person for NG tube feeding. So you can confirm to identify after checking of the case sheet. You can go and find out this patients or not. How means you can go and face the client, ask the client. Then you can confirm in the bed. Then you can go for the arranging for the all the articles like that. So this is no must. One thing. One for check the physician order. then easy to select the type of equipment. That is not rational. Another one, identify the patient, then you can receive the correct tube feeding or in your order in a right patient. That is not rational. That is not two nursing action and two rationals. Next, we move for the explain procedure to the patient and provide a rationale as to why that the tube is needed. Uh, Discuss the associated discomfort that may be experienced and possible intervention that may always this discomfort, answer any question as needed. Explain procedure to the patient because the patient easy to cooperate. What is the rationale is? The patient easy to cooperate and you can easy to administer, easy to insert the NG tube without the pain. Otherwise, what will happen? The patient feel far more pain. So difficult. The patient is not cooperated to you to the staff. So as a staff, explain to the procedure to the patient. Get consent to the patient. The patient is when the staff nurse is explaining all those things, get consent. So the patient also, I know the patient, the nurse is explained it already. So the fear level is reduced when the staff is explaining the procedure. That time the patient fear is reduced. So easily accepted, cooperated. The nurse also easy to administer the NG tube feeding as well as the easy to administer the NG tube into the patient without pain. So the patient is feel no pain like that. And fourth one, gather equipment including selection of the appropriate NG tube, polyurethane tubes. To gather the equipments depends upon the or select the tube based on the patients. Maybe this adult or adolescent or children like that. The age group wise, they select and gather all those things, all the equipments in the tray. This provides for organized approach to task. That is called as a fourth one. For third one, to explain the procedure to the patient, get consent to the patient. Here what will happen, explain procedure to the patient and because of easy to insertion without the pain. That is in a third one. Fourth one, gather the equipments, then only organized in organized manner, gather because of you can arrange in your organized manner, easy to approach to the task or approach the or achieve the goals. That is called in the fourth one. Fifth one, perform the hand hygiene, sterile gloves, and that is to maintain the aseptic technique. What is the rationale? Maintain the aseptic technique as well as the to prevent the spread of infection. That is called as an sterile techniques. And sixth one, close the patient's bedside curtains or door. Raise the bed, assist the patient to eye fowler's position, and elevate the head of the bed 45 degrees. Treat chest with bath towels or disabled pad. Have a MSS basin and tissue handy. Close the patient's bedside with the curtains or doors. Raise the patients in a high fowler's position in a 45-degree angle. Cover the chest with the use of the towel. And close the curtains or door provides for patient privacy. What is the fifth one is perform the hand hygiene, use the gloves to prevent the infection. Then close the doors and raise the head end and that is give the high fowler position, a head end of the 45-degree elevated. Cover the chest with use of the towel. What is the main rationale? One for the close, that is maintain the privacy. That is the sixth one. Then next thing is see about the sixth one. Next we go for the next slide. Seventh one, measure the distance to insert the tube by placing the tip of the tube at patient nostril and extending the to the tip of your earlobe and then to the tip of the xiphoid process. See, we measure the distance of insert the tube by placing the tip of the tube at this patient nostril and extending to tip of your earlobe and then to a tip of this xiphoid process. See, that is from the place that tube from the nose to the earlobe to the xiphoid process. You can, the nurse should take the NG tube to measure from the tip of the nose to earlobe and to the xiphoid process. This is must. Then only enter to the stomach. Another one is to lubricate the tube, tip of the tube at least 2 inches to 4 inches with water soluble lubricant. Applies topical anesthetic to nostril and oropharynx as per appropriate. Lubrication reduces friction and facilitates passage of the tube into the stomach. 1 for lubricate the tube 2 to 4 inches with the use of the lubricant jelly. What will happen? What is the rationale? To reduce the frictions of the tube, easily insert into the stomach. So 7th one is to measure the distance from the tip of the nose to earlobe to this xiphoid process. Then only you see to enough length of the tube is inserted into the stomach. 8th one, lubricate the tube 2 to 4 inches the water soluble jelly to avoid the friction and easy to enter into the stomach. This is my 8th point. 9th, after selecting the appropriate nostril, ask the patient to slightly flex edge back against the pillow, gently insert into the nostril while directing the tube upward and backward along the flow of the nose. The patient may gag when the tube reaches the fornix, provide tissues for tearing or watering of eyes. Offer comfort and reassure to the patients. When you are after the selecting the tube, what will happen? Ask the patient to slightly flex the head back against the pillow. Gently insert. You can use the left hand to separate the nostril and insert the tube into the nostril, and in a upward and downward and backward movement, you can insert the tube into the nose. Then immediately the patient may gag when the tube reaches the fornix. Immediately the patient eyes is become immediately watering of eyes combined with the use of tissues. Offer the comfort and reassure the patients. This is an insertion of the tube. This is to reduce the inserting the tubes, reduce the irritation and luckily hoods of mucosal injury. This is a 9th point. 9th point, the head is tilted backward and gently you can insert the tube into the nostril upward and backward, and then you can insert tube into the nose. Immediately the patient is gag and that we are watering of the eyes take place. Reassure the patient, give the comfort. Then it will be what is the reason, rational, reduce the irritations and likelihood of mucosal injury. This is a 9th point. 10th point, when fornix is reached, instruct the patient to touch chin to chest. Encourage the patient to sip water through a straw or swallow. Even if no fluids are permitted, advance the tube in a downward and backward direction when the patient swallows. Stop when the patient breathes. If gagging and coughing persist, stop advancing the tube and check the placement of tube with the tongue blade and flashlight. If the tube curls, straighten the tube and attempt to advance again. To check the specific gravities. One for what is the 10th point? To insert the patient to the chin to chest, touch the chin to chest, encourage the patient to sip the water through the straw or swallow. Even if no fluids are permitted, advance the tube in a downward and backward direction when the patient is slow. Stop the patient breath. If goggling or coughing persists, stop the insertion of the tube and check the placement of the tube with use of the tongue blade and flashlight. Then you can start to insert it. This is an 10th point. 11th, discontinue the procedure and remove the tube if there are signs to distress such as gasping, coughing, cyanosis, and inability to speak or hum. This is in the 11th point. Patient, the tubes are in this airway. The patient shows signs of distress and cannot speak or hum. The next 11th, 12th point, while keeping one hand on the tube or temporarily securing with the tape, determining that the tube is in patient's stomach. Attach the syringe to the end of the tube and aspirate the small amount of fluid, and you can measure the pH level, the pH of aspirated fluid using the pH paper or meters. Okay, then this what will happen after this insertion? Sometimes the patient are gagging, gasping, gogging, cyanosis. This takes place. While keeping one hand on the tube or temporarily securing with the tape, determining that the tube is in patient's stomach or not. How will you find out this the tube patient's stomach or not? One, for attach the syringe to the end of the tube and aspirate the small amount of fluid or stomach content is come out. So then you can confirm the tube in the stomach. Then through this way they can measure assess for the pH level of the use of pH paper or meters. Apply tincture of benzoin or other skin adhesive to tip of the nose and allow to dry. And secure the tube with the tape to patient's nose. And clamp the tube and cap or attach tube to suction according to the physician order for easy access. 13 point. After that insertion, you can check it whether it is auscultate. When it is presence in the stomach content is come out. Or any other coughing like that, what will happen? It presence in the difficult to respirate, breathing like that, what will happen? Respiratory passage. And this is you can easily to find out. And clamp, another one is clamp the tube, and you can, after that you can secure the tube over the nose with use of cellophane tape. And the clamp and caps or attached tube to suction according to the physician order only, and secure the tube to the patient's cone by using a rubber band or tape and a safety pin to prevent the aspiration, and replace all the articles and wash hands to prevent the cross infection. And in this, after that 17th one, document the procedure and is record the condition of the patient and response of the patients, report any abnormalities to the nurse in charges. And this is one of the evidence that only to recorded and reported the staff nurses. So far I discussed in what are the things. One, that is now how to insert the tube into the nose. When you are inserting the nose into the tube into the nose, first you can select the size, then measure from tip of the nose to earlobe to stomach is a process. Then you can lubricate it with the lubricate jelly. Then you can assess the nose, any other crust formation like that with use cream, with use of cotton buds. Then you can insert it slowly and upward and downward movements. Then it enter into the stomach or not. You can with use of syringe, you can stethoscope, you can assist. Then if it is stomach, it comes for the stomach content or the any other fluids like that. It is not there, what will happen? It confirmed the presence in the respiration, respiratory passage or respiratory system. So you can withdraw again, you can applying for the NG tube. After that administration, you can keep the tube over the nose and then keep it in the you can keep it in safe over the nose with the use of the cellophane tape. Then after that, you can end of the tube, you can cork it, then prevent the enter of the air. If it is the doctor's advised, any other aspiration of or suctioning of any stomach content like that, you can attach it for the suctioning or suctioning apparatus also. Then after that, every time when you are administering for the content or any other medicine like that, every time you can administer when you are applying administer for the or inserting the NG tube, when you are administering for the fluids or foods or medicine, how much amount, date, day, and amount and quantity, and this are all the things you can documented or recorded. Then after that, you can report it to the ward sister also. Then only easy to prevent the complication of the patient. If it is any, sometime it's happened for any other complication, easy to manage, easy to treat the patients and from the illness. This is for the documenting the procedure. And preparation of equipment of nasogastric tube feeding. Clean tray liner with the paper containing towel, a 50 or 20 cc syringe, a 5 or 10 cc syringe, stethoscope, bowl with water, K basin, feeds, pre-measured water, ounce glass, adhesive with scissor. These are all the things for the clean tray liner with the paper containing. Nursing procedure, nursing action, and rational. Explain the procedure to the patient. Review rational, always the anxiety and enhance the cooperation. Review physician order for type of internal feeding schedule to ensure the correct care. Assemble the articles near the bedside and provide privacy. Organizes procedure and limit the patient discomfort. One for explain procedure to the patient, get consent to the patient, physician order, check the physician order, and arrange all the articles in the patient bedside. This is 3 things for the nursing procedure. Fourth one, position the patient in the Fowler's position, prevent the aspiration, place the towel across the chest and prevent spilling of linen. Confirm the position of the tube by following method. One for auscultation method, 5 to 10 ml of air with the help of 10 cc syringe, and check the position of NG tube by placing the stethoscope on the upper left quadrant of the stomach, so easily to prevent the aspiration. One for give Fowler's position. Another one is place the towel over the chest. This 2 things for prevent aspiration as well as filling and lining to prevent. Another one is how to confirm with the use of a syringe, end of the tube, you can connect it, then aspirate it, and place at the same time you can place for the stethoscope over the upper left quadrant of the abdomen. You can check it whether it is tube is present in the stomach or not. Aspiration to check whether the aspirate contains stomach content or not. Bubble with the water and pinch the end of the NG tube and keep the tip in the water and check the presence of bubbles are present, indicate the tube in the lungs. One for auscultation with the use of the syringe. Use the syringe and stethoscope in the upper left quadrant of the abdomen. Another one is next thing is aspiration of the stomach content. Third one is bowel with water. End of the tube, keep it in the 1 bowl of water. What will happen? Bubbling sound is take place. So the presence in the lungs, the tube presence in the lungs. Okay, this is the 3 method. And the intermittent flow method. Attach the barrel of the syringe to the tip, pinch the tube, and pour the 10 ml of water to initiate the flow. Elevate the barrel of syringe along with the tube height. Once the water flows, lower barrel and pour the feeds and lift the barrel high again. So what will happen? It move by the specific gravity, the food content or something. And once the feed enter by the gravity, refill the syringe with the feed until the feed gets over and flush the tube with the 10 to 15 ml of water to prevent the residue formation. And continuous flow by bag method. Hang the bag in the IV pole. Check the residual every 4 to 8 hours to enhance the flow by the gravity. One for syringe, you can that is not barrel of syringe you can use to give the feeding. Another one method, and you can inflate the feeding for 10 to 15 ml. And another one is a bag method to hang the bag in the IV port. You can maintain for 4 to 8 hours. Next thing is touch the tip of the tube to regulate it, and open the flow wall and adjust the rate and monitor the flow of feed. Once it gets over, administer water via the tube and disconnect the tubing and replace the articles for easy access, and encourage the patient to maintain the same position for another 15 to 30 minutes to prevent the aspiration. After that, each and everything, and monitor after the administration to check the monitoring of the flows, and apply administration. After that, administer the water and check the flow is each and everything. And after that, you can cork it end of the tube and close it end of the tube and replace all the articles and encourage the patient to maintain the same position for 15 to 30 minutes to prevent the aspiration. And after that, all the articles is replaced and washed and dried in the sunlight. Then after that, keep it in the cupboard. And the nurse go and wash the hands properly to prevent the infection. After that, document the procedure, record the condition of the patients and response of patients. Because then only easy to handle the when any other complications take place. The patient are suffered by the any other illness for after that administration of food or medicine like that. What will happen? Easy to manage and recover from the disease from the patients, right? So then that is one thing. Another one is now report any abnormalities to the nurse in charges. When you are administering for medicine or fluids or the foods during the NG tube feeding, any other abnormalities take place, anything aspirations take place, what will happen? Immediately inform. This all the things happen. This all things happen, sister, like that you can inform it orally. So the nurse will keep it in the mind, as well as the after take place of any complication, easy to manage the nurse. So this is records and reports is very important. It serves as a legal evidence also. That is in a 17th point. And this is in a how to measure and how the tube is inserted and settled in the stomach. Now with the nasogastric tube is here. Here nasogastric tube entered and into the esophagus and into the stomach. Okay, this is an NG tube. Next, we move for the nurse's responsibility. Check the feeding tube remains intact. Check whether the patient has no respiratory distress. Verify the tube is in stomach or in intestine. Record the date, time, type, and amount of fluid given. Specify the patterns of the tube, characteristic of the aspirated, and condition of the skin at the incision of the site. Record the additional amount of water and before and after procedure, and as well as the intake and output chart should be maintained, and verify the colors and pH and appearance aspirated, and confirm the X-ray result, and routinely assess the location of external exit site. And another one is residual volume for every 4 to 6 hours once. This all